What is going on, guys? Happy Wednesday. And tonight is an important topic. We're going to be talking about the tripod foot. The reason why I want to talk about the tripod foot is because it's so special and so pretty much like just indicated and needed for so many people, whether you're a weightlifter, just an average Joe going to the gym, or just someone squatting throughout the day. If you have hip, knee, or ankle pain, typically it could be because you're squatting this way and because you're not using the tripod foot to your full effect. So the easiest way I'm going to demonstrate this, I've been doing it with my clients all week after I found this awesome video through an app that we use called Muscle in Motion. So I'm going to show you the video and just explain, rather than you listening to them talking about it, kind of give you my preference on it and explain how I kind of cue people in the clinic, like when they're doing it too. Because you shouldn't just think about using a tripod foot when you're squatting. You should translate it to all of your exercises: lunges, lateral band walks, bear crawls, whatever you're doing where your foot's kind of planted on the ground, single leg deadlift, normal deadlifts, right? It's so important. And we're going to go through like why you need to kind of use the foot first as the foundation, just like the foundation of your house, right? If you don't have a strong foundation, it's going to blow over. Or if you have a leak, right, in your foundation, then what can happen is like it can lead to cracks and it can destroy the house, right? So it's so important to have a strong foundation because you land on it. It's where all the issues typically start in people with knee and hip issues. So it's so important. That's why we're going to go through this here. So let me share my screen. All right, so tripod stance, right? We're going to go through, these are the three kind of points of the tripod. So if we play the video here, right, they're just going to explain really that there's three main points of contact where you want to keep your weight, and it's your calcaneus, your heel bone, right here, the base or the head of your first metatarsal here, right, kind of that knuckle joint of the big toe, and then you have your first kind of metatarsal joint here, right, called MTP, metatarsal phalangeal, of your fifth metatarsal, right? So again, number 1, number 5, right, or big toe, pinky toe, the base of them, and then the heel bone. So you want your weight evenly distributed between these 3 points. So as you kind of do a squat, right, you want to push your big toe down, push your pinky toe down, push your heel down a little bit, and then also try and bring these 2 points together, aka your big toe here and your kind of heel bone, to create an arch in the foot. Okay, so again, they're just going to show you the 3 points there. Right, one centered on the calcaneus, one here on the fifth metatarsal here, the head, and then one here on the first metatarsal head. This is kind of the most important part. So if you're not paying attention, pay attention right now, and you can even write down some notes here if you want to. This arrow demonstrates that you should be pushing good weight through your big toe. Sometimes it helps if you do a squat with a band right underneath your big toe, pulling out to the side. Right? So say it's like you're working on your right big toe. You can have a band underneath your big toe on the right side, pulling to the left, attached to something else. And you have to make sure that big toe stays down as you're squatting, and that way your toes won't curl or anything, which makes things a little bit worse and makes you lose your balance. But it makes sure you're going to splay your foot out, meaning if this is your big toe, you're going to splay it outwards from your outer four toes, excuse me, and you're going to push it down a little bit to maintain that stability and balance in your foot. So again, that's number 1. Number 2, you're trying to bring that point to your heel. So you're trying to bring point 2 here to point 3 to create a short foot, right? So pushing down, bringing it up, creating an arch, right? You're trying to distribute that weight, and you should be doing it while you're squatting, right? So down, and then if you don't do it, this is what's going to happen, right? They're showing you that if you do not create a short arch in your foot and push your big toe down and kind of work these muscles, those knees are going to collapse inwards, and you're going to get hip internal rotation because of that, and that's going to cause hip impingement, and it's going to cause outer knee pain, typically here around the lateral meniscus or the LCL ligament here where my cursor is. So you should be pushing your knees out and creating an arch, and they're going to show you the knees in a little more detail here. So again, this is her doing it improperly. If you're collapsing your foot inwards, this is what's going to happen to your knees. That's why it's always not a good thing, because it's okay to squat like this, like when you're just starting off as you're learning. But if you're putting weight on your back and you're doing this over a long period of time, you're going to eventually develop ankle, knee, or hip issues. It's going to climb the chain. Usually it starts at the foot first, then it's going to move up to the knee, then it's going to move up to the hip. So it's so important to create the arch in the foot, push the big toe down, turn the legs out, and then hold those 2 positions as you squat, right? And then this is even better icon here. Let me get rid of the captions. So again, big toe down, pushing outwards. So you shift that weight out a little bit, create an arch, and then that knee should be externally rotating, right? So it's actually hip external rotation. So you're going to create more space here and use more of your glute med muscle, your glute max muscle here, because you're going to shorten them, right? You're going to turn that knee out as you create the arch, and that's going to create a stable base that you can squat on. It's functional and safe for your joints. Okay, so again, arching the foot, knees out each time you squat. And you can reset. It's really hard to hold that position. And sometimes coaches relate it to a corkscrew, right? You're like corkscrewing your feet in the ground. You're kind of twisting them outwards a little bit and then rotating your knees out. And I will say a lot of coaches will tell you instead, they'll be like, just turn your feet out as far as you can. And that's an okay cue, but it's not always the best cue for every person, because it depends on your anatomy too. Some people, like if you turn your feet out all the time, it's going to compensate for you not doing this of what I just explained. It's going to compensate for you not turning your hip out into external rotation and turning your knee. It's also going to be compensation for having flatter feet or from collapsing inwards. So sometimes look for that. Like if you're a coach or your personal trainer or physical therapist, if someone has tight calves or really weak foot muscles, they'll tend to really turn their feet out as a compensation, and that kind of hides kind of their weakness there. So I always have people squat in different kind of foot positions, right? Usually foot out, foot a little bit more inwards, and then foot neutral. And then I have them pick which one they feel the most comfortable in. And then we kind of work into that too. Of course, based around their anatomy too, and what dysfunctions they kind of came up with during the assessment. But hopefully that makes sense, okay? That was into the video. So just to recap, right, tripod foot are these 3 points. So anytime you're squatting, deadlifting, anything where you're planted on the ground in a closed chain exercise, you want your weight distributed between these 3 points, right? Heel bone, head of the 5th metatarsal, head of the 1st metatarsal, right? And then the 2 things you need to do is you need to push your big toe down, create an arch in your foot, and then turn the knees out, okay? You do those things, you're gonna have healthy knees, healthy hips. You're not gonna have to see me, or you're not gonna have to see any physical therapist in the clinic. You're not gonna look like this when you're squatting, right? And that sometimes scares people in the gym. Like they'll come up to you and be like, you okay, what's going on? And you don't have to deal with that. So that is all I have for tonight, guys. I hope you found that helpful. If you have any questions or you have foot, ankle, or knee issues, please let me know. This could be a missing link, or it could be something that's causing your pain because you're not doing this. Okay, so you need to practice this. It's really hard to do. It looks super easy when you see the diagram, you see the skeleton model doing it. But I will say, like, I have to work with patients sometimes for like a good 2 to 3 weeks before they kind of get it ingrained in their head, and then they can work on that coordination and mind muscle control. It takes a lot of practice, a lot of skill, and coming to the clinic just 2 hours a week isn't enough time. They got to do it at home, and they got to use a mirror, and they got to record themselves doing it and watch themselves. I find those 2 things help a lot as biofeedback. So again, guys, thank you so much for tuning in. I know it was a short one. I have a tendency of going too long in these videos, but if you watch, thank you so much. And if you want more kind of content based around the knee or the foot, let me know down below. Or if you want stuff on the shoulder, let me know that too. All right, have a great rest of your week, guys. We are almost at the weekend, and have a great night.